Hello friends, in this brief video I shall touch upon T-cell alloreactivity. So what I'm trying to do is highlight some basic concepts related to bone marrow transplants. Now we all know these days haploidentical transplants are becoming more common where we can use one of the parents as the donors. Though they are not complete match, still we can transplant using such a haploidentical donor when we do this HLA typing. Now, the major challenge with haploidentical transplants is increased risk of graft versus host disease and graft rejection. And this is primarily mediated by the alloreactive T cells. Now, what do you mean by alloreactive T cells? The T cells which recognize the foreign antigens and try to attack them is what we mean by alloreactive T cells. Now, interestingly, there are two types of T cell alloreactivity. One is called the direct T cell alloreactivity that you can see on the top panel here, and the indirect T cell alloreactivity which is highlighted on the bottom panel. Now I'll quickly make you understand what is the difference and why is this important. Now we all know T cells recognize antigens only when they are presented via the MHC or the HLA molecules, right? Now, if you do a transplant and the donor tissue is transplanted to a recipient, now the host T cell may attack the donor. If the host T cell recognizes the peptide which is presented by the donor MHC, now that is direct T cell alloreactivity. So basically, in direct T cell alloreactivity, as you can see from the top panel, the antigen presenting cell or the MHC is a foreign MHC when you're speaking of the host, isn't it? So the host T cell is basically attacking or recognizing the intact HLA and peptide complex presented by the donor antigen presenting cell. Now, when it comes to the indirect recognition, which has been highlighted in the bottom panel, here the host T cell is actually recognizing the peptide which is presented by the host antigen presenting cell. That means it is a self MHC, but the peptide is a allopeptide or a foreign peptide. Now, when you do a transplant, what will the host APC present? Basically the mismatched antigens. And if you are doing a haploidentical transplant, then it is the mismatched HLA which has been processed and presented by the host APC to the host T cell, mediating alloreactivity in haploidentical transplants. So it is basically the MHC which is mismatched that has been presented. Now, but we also know that even when we do a matched sibling donor transplant, there is a risk of GvHD. Then what, and there is also a risk of graft rejection at occasions. So then what are the host T cells recognizing? Because the MHC is matched. But when we say matched MHC, it is the major histocompatibility antigens that have been matched, right? But imagine a situation where the host APC is presenting an antigen in a match setting to the host T cell. So this antigen which has been processed from the donor, but it is not MHC antigen. It's another antigen which has been processed by the host APC and presented to the host T cell. This will be considered as the minor histocompatibility antigen because the host T cell is attacking it, but this does not belong to the MHC group. Now, these minor histocompatibility antigen recognition and attack is the reason why you can develop GvHD and graft rejections when you perform a matched donor transplant. Unfortunately, we do not have mechanisms to recognize such minor histocompatibility antigens at the moment. However, understanding T cell alloreactivity, both the direct mechanism and the indirect mechanism, helps us to understand why in matched donor transplants you can still have a T cell alloreactivity. Thank you.